And if you're sexually active, you're at risk for HPV.
In fact, it is the most commonly transmitted infection in the United States, yet many parents don't realize we can protect our children from it.
In tonight's Health News to Use, Karen Larson looks into the virus that can cause cancer with a kiss.
Adults are walking into a new threat, and so are young teens. The human papillomavirus is spreading fast with no symptoms and few warning signs.
There's approximately 20 million Americans that are currently infected with HPV, and then there'll be another 6 million that will be newly diagnosed in the next year.
The American Cancer Society warns as many as half of those who are sexually active will be infected with HPV. Known to cause genital warts, it also causes cervical and vaginal cancer in women. Dr. Brad Mons at Cancer Treatment Centers of America in Tulsa says he's now seeing cancer linked to HPV in men, too.
It's been shown to cause head and neck cancer, mainly cancers of the tonsil and the back of the tongue.
HPV is spread by sexual contact and kissing. Yes, just kissing.
Especially that passionate kissing, French kissing, soul kissing, deep throat kissing, whatever they want to call it nowadays. That transfer of saliva does increase that risk of getting the disease, the human papillomavirus.
Not everyone who is exposed to HPV will get cancer, but Dr. Mons warns he is treating more cases.
Unfortunately, we're seeing a lot younger patients with throat cancer because of HPV. They get exposed to it when they're around 15, 16 years old after they have their first encounters. And about 15, 20 years later, sometimes even 10 years later, they get throat cancer. So we're seeing throat cancers in people who are 30, 40 years old.
Which is why he believes the vaccine is so important to protect children before they're exposed to the virus with their first passionate kiss or intimacy.
My children have received the vaccine. I have 3 children, 15, 14, and 11. And all 3 of them have received the vaccine or are getting the vaccine.
New guidelines lowered the recommended age for girls and boys to between 11 and 13.
Adolescents are already going in for their vaccinations at that time anyway, the Tdap and the meningococcal. So it's just a great time to have that vaccine there.
Dr. Mons says while cancer caused by HPV responds well to treatment, the vaccine is a game changer, helping prevent disease before it occurs. With Health News to Use, Karen Larson, 2 Works for You.
Right now, by the way, less than 40% of Oklahoma children are protected with the HPV vaccine.